Hey everyone, my name is Dr. Camille Norem. I am a chiropractor here in Alexandria, Louisiana. I have my Bachelor's of Science in Kinesiology, I have my Doctorate of Chiropractic, and my Master's of Science in Functional Nutrition. And today we're going to be talking about a couple of healthy lifestyle choices that we can do throughout pregnancy. So there are four main components that I like to consider a healthy lifestyle during pregnancy. The first one is appropriate weight gain. The second one is a balanced diet. The third is fluid intake or water intake. And the last is regular exercise. So starting out with a healthy weight gain during pregnancy. Weight gain during pregnancy is totally normal and it is healthy in general. Depending upon how much weight you gain throughout pregnancy is going to depend on a bunch of different factors. How much did you weigh before you got pregnant? Do you have any underlying health conditions? Were you currently physically active before pregnancy? So some women typically gain 10 pounds throughout their pregnancy. Some may gain 60 or 75 pounds. I am currently 33 weeks pregnant, and I've had a normal, I would consider, amount of weight gain. But what is normal, right? Typically speaking, in your first trimester, you can gain anywhere from 1 pound to 10 pounds throughout the entire first trimester. Moving into that second and third trimester, you're looking at gaining about 1 to 3 pounds per week. Again, always consult with your OBGYN or your primary care provider on what is a healthy weight gain throughout pregnancy for you specifically, because there are a bunch of different factors, but weight gain during pregnancy is normal, it's appropriate, and it's healthy for mom and for baby. The second aspect of maintaining a healthy lifestyle during pregnancy is having a balanced diet. So a balanced diet can look like a bunch of different things. Primarily speaking, I always try to tell everyone in the most simplest of terms, try to eat food that God made, right? So God made bread, He made rice, He made potatoes, He made fruits and vegetables and meats and fish. All of those things are phenomenal to be including in your diet throughout pregnancy. Try to avoid those foods that God didn't necessarily create, like chips and Doritos and Cheez-Its and chocolate bars. Of course, some of those things are normal cravings throughout pregnancy, but overall trying to look at eating foods that God made is going to be super beneficial just as a general overview. However, when we're looking at calorie increases, a lot of times we hear the phrase, oh, I'm eating for two now. That isn't necessarily the case, right? So breaking it down into our trimesters. During the first trimester, your caloric intake or the amount of calories that you're eating should not increase, okay? So during your first trimester, you should be eating the same amount of calories that you were eating prior to becoming pregnant. However, during trimesters 2 and 3, they recommend that you increase your calories by 300 calories per day. So we do need to be eating a little bit more in our second and our third trimesters. But during that first trimester, try to maintain what we were doing before, okay? That is gonna look a little bit different if you're carrying twins or if you're carrying triplets, but if you're carrying one baby, then that's the general recommendations, okay? Another really important aspect to maintaining a balanced diet during pregnancy is protein intake. So our body gets its energy from 3 different sources. It gets it from proteins, carbs, and fats. Proteins are so important for a healthy pregnancy for mom and for baby. So trying to increase our protein intake is going to be so beneficial. There's a lot of different foods that are high in protein, and we want to be shooting for about 75 to 100 grams of protein a day. That sounds like a lot, but don't let that scare you. About half of a chicken breast has 26 grams of protein in it. So it's really easy to sneak some protein into our diet. Some of the other foods that are high in proteins are things like cottage cheese, peanut butter, almonds, pumpkin seeds, any of our meats or fish. All of these are super high in protein and eggs. So try to increase the amount of protein that we're having per day. And last but not least is managing those cravings. So it's no secret that throughout pregnancy, you're gonna have some cravings, whether those be salty or sweet. With those cravings, my philosophy is eat what you'd like and add what you need. So if you're craving a Hershey's chocolate bar, it's totally okay for you to have a Hershey's chocolate bar, but maybe add in an apple and peanut butter to go along with that. If you're craving a little chips as a snack, maybe add in some hummus and some celery to go with it as well. So eat what you'd like and then add what you need for nutrition to go along afterwards. Another important aspect of maintaining a healthy lifestyle during pregnancy is fluid or water intake, including our electrolytes in there. So just like we mentioned with our protein aiming for 75 to 100 grams of protein every single day, we should be aiming for about 75 to 100 ounces of water every single day during pregnancy. So during pregnancy, our blood volume, how much blood we have in our body, and our fluid volume is going to be increasing from the time you conceive all the way till you deliver your baby. So that fluid intake is going to increase, that blood volume is going to increase, so we need to be increasing the amount of water that we're drinking. To give you a reference, a general water bottle that you can buy at the grocery store at a gas station is about 16 ounces. So if we're drinking 7 to 10 of those per day, you're doing a fantastic job. Water is so vital for our overall systems, again, for mom and for baby. There's also a lot of research that shows if you drink more water, there's less pregnancy symptoms, I guess you could say. So having more water in our bodies is going to decrease the symptom of constipation. It's also going to help with swelling that's really associated later on in pregnancy in trimesters 2 and 3. To go along with our fluid and water intake is talking about electrolytes. So electrolytes are minerals found within our body that are responsible for moving all of that fluid in our body in different places. So the 3 main minerals that I want to discuss are sodium, potassium, and calcium. These 3 are huge in making sure that all that fluid is exactly where it needs to be. So if possible, grab one of those little electrolyte packets. My favorite is LMNT electrolyte packets. You can get some mineral drops or adding in some really nice coarse salt into our water just to make sure that we have those extra electrolytes to make sure that all of that fluid and all of that water is exactly where it's supposed to be. Last but not least is physical activity. So physical activity is so important in life in general and during pregnancy. So throughout your pregnancy, it is so important that you are either continuing the physical activity that you were doing prior to becoming pregnant or starting something new, right? General rule of thumb, if you were physically active prior to becoming pregnant, continue doing those physical activity things. If you played tennis or pickleball with your friends, continue doing so. If you enjoyed running or swimming, continue doing so. If you went to group fitness classes or were a weightlifter, you can absolutely continue doing those things. Of course, talk to your primary care, your OBGYN, before continuing, especially if your physical activity beforehand was a little bit more risky compared to others. But overall, the general rule of thumb is if you were doing this physical activity prior to becoming pregnant, it is generally safe for you to continue doing that throughout your pregnancy. If you were not physically active prior to becoming pregnant, I highly encourage you to pick up some form of physical activity. A great place to start is walking, right? So I recommend walking 15 to 30 minutes a couple times a week. You're gonna notice a huge difference in the way that your body feels and the way that your baby feels. It's overall great for health and wellness. Give yourself a small goal. You can start out by saying, I'm gonna go for a walk for 15 minutes 3 times a week. And as you get more comfortable with that physical activity lifestyle, you can bump that up to 5 times a week, 7 times a week, or even for longer periods of time. Swimming is another phenomenal exercise that we can do for our babies and for ourselves throughout pregnancy. It's a great form of cardio and it's really easy on the joints and on the body. With physical activity, another thing that you'd like to incorporate would be, if you've never done any sort of physical activity before, is doing general body weight movements or even weightlifting. If you aren't interested in starting weightlifting once you become pregnant, I highly encourage you to talk to a personal trainer or an athletic trainer, but there are a lot of body weight exercises that we can do to prepare ourselves for pregnancy as a whole and prepare ourselves for labor and delivery. So now we are going to walk through a couple different body weight exercises that we can do that are safe for mom and safe for baby. All right, there's a couple of different body weight exercises that you can be doing throughout your pregnancy to prepare yourself for labor and delivery. So being pregnant is one of the most physically demanding things that a woman will experience in her lifetime, and it's something that we should be training for, right? So there's a couple of different body weight exercises that you can do to, again, improve overall health and wellness, make sure that the pregnancy is safe, and have a smooth and successful labor and delivery. The first one is a simple body weight squat. So what you're gonna do is you're gonna put the shoes about shoulder width apart and you're gonna go down into a single squat and come all the way back up. Depending upon where you're at in your fitness journey, you can lower your squat all the way down or you can just slightly bend the knees. You'll notice that my back is completely straight and my belly is supported when I go down into the squat. I'm not rounding the back, I'm not arching the back, it's a simple squat. With the simple squat, once you get further on into your pregnancy in the 3rd trimester, like I am, it's very important that we open up our pelvic floor. So one of the things that we can do is a deep body weight squat. So instead of just doing a regular squat here, doing that a couple of times for physical activity, you can spread the legs a little bit farther and come all the way down into a body weight squat. What this is going to do is this opens up our pelvic floor and prepares the body for labor and for delivery. Holding this position here, and I'm going to demonstrate from the side as well, you'll notice that my back is completely straight. Holding this position here for about 2 minutes every single day in your third trimester has really shown to decrease labor and delivery times. Another great exercise that you can do is a lunge. So a good thing about all of these is they have progressions, right? We just talked about with our squat, you can do a simple squat, do about 10 of those. You can deepen the squat and come all the way down, or you can go all the way down into your full squat. Same thing goes for our lunges. So with a lunge, you're gonna put 1 foot forward and 1 foot backwards, and you're simply just going to bend your knees and then come right back up. You can squat all the way down to where that knee touches the floor, or you can even come all the way down onto one knee and again, open up the pelvic floor. So the way that we would do that is we come all the way down into our lunge and then slide our hip forward. Just like in our squat, we were opening up our pelvic floor, this is another way to do that along a different plane. So lean forward and then come right back up. And again, we can do the same thing on the opposite side. So our squat and lunge variations are phenomenal for opening up our pelvic floor and maintaining that musculature in our legs and our glutes that prepare us for labor and delivery. One of the common myths that we hear with pregnancy and working out is that we can't do any core exercises. That's not true. We need to have a strong core and a strong back to be able to birth our baby. Just because we have a baby bump doesn't necessarily mean that we can't do core exercises. My only recommendation is do not do any core exercise that involves crunching of the abdomen. So we don't want to be squishing the abdomen in any way. I would avoid things like sit-ups, crunches, throw downs, ankle taps. All of those are constricting the abdomen. There's ways that we can strengthen our core without doing so. So let's walk through a couple of these. The first one is a plank. A plank is an isometric exercise that's phenomenal for strengthening our core. You can do a plank in a variety of ways. You can do the plank all the way on your hands. You can do them on your elbows. You can do them with knee support or no support at all. So a full plank is going to look like so. You'll notice that my back is completely straight. You can also come down onto the knees, or you can come all the way down onto the elbows. All of these are different variations of a plank. You're gonna try to hold the plank anywhere from 10 seconds to 45 seconds, depending on your physical activity level. So we just went over a regular plank, and we're also gonna go over a side plank. So the regular plank is gonna strengthen the middle part of our abdomen, and the side plank is gonna target the side part of our abdomen. So with the side plank, similar to the front plank, you have a bunch of different variations. The larger that our abdomen gets, our belly gets, our baby gets throughout pregnancy, we may need to do this a little bit more supported. So what you're gonna do is you're gonna come onto your elbow and lay on your side. You'll notice that my abdomen and my core is completely supported, and you're going to push up off of your knees and hold here. Again, you can do the full plank where the legs are completely out and you're lifted all the way up, or you can stay on your knees and hold here. So of the 4 exercises that we just listed, the squat, the lunge, the front plank, and the side plank, all of these are phenomenal for preparing our body for labor and delivery and opening up our pelvic floor. If for some reason you have additional questions on which exercises are safe during pregnancy or are beneficial for labor and delivery, I highly recommend talking to a prenatal or pediatric chiropractor or a pelvic floor physical therapist. These are going to be great guidelines for you moving forward.